Assalamu alaikum. My name is Ariba Hassan and my topic is anti-venom immunoglobulin. My roll number is BP 1650037. What are antivenoms? Antivenom immunoglobulin, also known as venom antiserum and antivenin. It is a specific treatment for snake bites. It comprises of antibodies. The need of antivenom depends on the type of animal involved. It is given only by injections. Antivenom is produced by purification of polyclonal immunoglobulin from plasma of large animals pre-immunized by snake venom. Rational use. Antivenom is the key treatment for venomous and poisonous snake bites. There are two types of antivenoms: polyvalent antivenoms and monovalent antivenoms. Polyvalent antivenoms counteract venoms from many species, while monovalent antivenoms are specific for specific venoms. Therefore, polyvalent antivenoms are preferred over monovalent antivenoms because the snake species are often unidentified in clinical practice. Antivenom therapy can quickly reverse snake bite-induced coagulopathy and limb edema, but muscular paralysis from presynaptic toxins, tissue necrosis, and renal failure resolve much more slowly, especially when antivenoms are given late after bites. Irrational use or side effects. Side effects may be severe. They include anaphylactic allergic reactions, shortness of breath, serum sickness, and other allergic reactions, as seen in this picture. What is serum sickness and what are anaphylactic reactions? See here, antivenoms are extracted from animal serums by a number of procedures and may include other serum proteins that can act as immunogens. Some individuals may react to antivenom with the immediate hypersensitivity reaction that is known as anaphylaxis, or a delayed hypersensitivity, that is serum sickness reactions, and therefore antivenom should be used with caution. Alternative brands. First, we have Crofab. Its generic is antivenom and it is polyvalent. What are polyvalent? As we discussed before, that polyvalent are not targeting the specific species, they are target general species of snakes. Dosage forms, they are available in the form of injections, powder, lyophilized for solutions, but we only give it in the form of IV. Intravenous injections. Administration. Administer Crofab as soon as possible in patients who developed any signs of envenomation, that is local injury, coagulation, abnormality, or systemic signs of envenomation. To prevent clinical deterioration, Crofab was shown in clinical studies to be effective when given within 6 hours of snake bite. The other uh, alternative brand we have is NS Corp. Generic is also antivenom. Dosage forms are as same as Crofab, and administration. Initiate treatment with NS Corp as soon as possible after scorpion sting in patients who develop clinically important signs of scorpion envenomation, including but not limited a loss of muscle control, roving or abnormal eye movements, abnormal speech, respiratory distress, excessive salivation, frothing at the mouth, and vomiting. Other alternative brands we have Anavip and Antivenin. These both brands are as similar as in properties as the previous brands. They have the same generic dosage form, available in same dosage form, and have same administration procedure. All the antivenoms, you have to give them as soon as possible after snake bites or scorpion bite. Drug interactions. Antivenoms can interact with persons having an allergy to horses or horse serum. This drug can also produce side effects if a person is allergic to antivenom or any other drugs, foods, or substances. Here we have some name of the drugs uh, that antivenoms interact with. These are very common drugs: cetirizine, aspirin, diphenhydramine, celecoxib, and esomeprazole, nitroglycerin, imipramine, sulfamethoxazole, and beta blockers, and many others. Adrenaline is also present in this list. Potassium chloride is also present, and we have many more drugs with which antivenoms are antivenoms interact. Case presentation: a 29-year-old housewife came to the emergency department of the university hospital complaining of a swelling in her right arm after an exposure to an unknown bite at her house yard. Initial examination revealed a fully conscious patient with stable vital signs and arterial blood gases. Local examination of the patient's right arm showed edema, redness, hotness, swelling, tenderness, and two insertion sites in her right arm with dark tissues around, as shown in the diagram in the picture. On examination, the patient was fully conscious, reads the scale, pulse 85 per minute, regular and full, BP 110 per 70 mmHg, eye pupils, and the chest was free on osculation. Chest X-ray showed white shadows of lungs infiltration. Here we have our case study in which subject is patient came with a complaint of snake bite 20 hours ago, followed by pain, redness, swelling on her right arm. Her age is 29, gender is female, physical examination as we have already read in the case. Local examination on her right arm showed edema and swelling and two insertion sites with dark tissues around denoting necrotic tissue, and these two sites are mostly the insertion sites of a biting animal, mostly the wings of a vasculotoxic species. Vitals, as we already discussed, diagnostic test includes chest X-ray showed lung infection. What will be the treatment? So I suggest the treatment that the patient must be admitted in the hospital with fluid therapy and continuous monitoring, and vascular surgery consultations should be done to manage the swelling and tissue necrosis in the affected limb. Snake antivenom should be administered promptly by IV infusions alongside short-acting corticosteroids, and an antihistamine infusion is in another IV line. Anti-edema and antacids were given. Surgery may be required for edema and necrotic tissues. Appropriate antibiotics were prescribed for the patient based upon a sputum culture for the lung infection. These are the following references of my whole presentations, that is WHO, and I took reference from IBM, and as you show there are three more references by which I prepared my assignment. Thank you so much.